Hi, my name's Megan. I'm a student at MTC. I'm going to be demonstrating how to do a central line dressing change today. So first things first, I'm going to make sure that I check my orders, check my chart, make sure that we actually do need to change this dressing, which it is due to be changed, so we're good there. I'm just going to gather all my supplies and I'll head into the room. Hi Chester, how are you doing today? Good. My name's Megan. I'm going to be your nurse. I'm going to wash my hands, provide for privacy. So today we need to get this dressing change that's over your central line. I see there's a little bit of blood on there, and we like to change it every so often just to help prevent infection. He says, okay. So he gives me consent to do the procedure, and then I just want to make sure, Chester, this might take a few minutes, and I'm going to need you to hold your arm really still while I do this, just so that I don't get so that way I'm not touching the insertion site. We want to keep it nice and clean. I'm also going to have you wear a mask just for the few minutes while I do this. It just will help keep the bacteria away from that line. He says that he will be able to sit still, and he will be able to wear the mask. So a couple lifespan considerations. If he weren't able to sit still, maybe he was a little delusional or I was dealing with a pediatric client, I could bring another nurse in with me just to kind of make sure that he's holding still and that I'm able to maintain sterility. And then if my patient wasn't able to tolerate a mask, I would just make sure that they were turning their head away from the site of insertion. So in Chester's case, I'm changing his PICC line on his right arm. I would have him turn his head to the left. But that won't be an issue. He is able to tolerate both of those things, so we are good to go there. So before I start anything, I want to make sure that I wash my hands and put some clean gloves on, and then I'm just going to kind of start to assess this arm and assess the site. So first I'm going to measure arm circumference. I'm going to go 6 inches above the site of insertion, and then sorry, my sound's on my computer. I think a message just came through. Okay, so I'm going to go 6 inches above the site of insertion. So that puts me about right here. And then I'm going to measure arm circumference in centimeters. And they just do this to kind of monitor for any changes in arm size, because that can be a sign of extravasation or infiltration. You know, the line might be displaced in there somewhere, there might be a clot. So I'm going to record that measurement, and it's within normal limits, no big changes there, so that is a good sign. Make sure I'll write that down. I write that down just so I don't forget that number while I'm in here. I'm also going to kind of take a look at this insertion site. I'm going to, since it technically is a wound, I'm going to assess Rita, so we're going to see if there's any redness, ecchymosis, edema, drainage, and approximation. So the wound is well approximated. It's just a puncture wound. There's no redness or anything, and Chester doesn't feel any tenderness while I'm palpating around. So those are all good signs. And before I take that dressing off, I want to make sure that both me and my patient are wearing masks. So I'm going to wash my hands and then put my mask on my patient, and then wash my hands again, and I'll put my mask on, wash my hands, and then I'm going to put some clean gloves on because I am going to open up my sterile package here and grab out my forceps. So I'm going to open this away from me, and then using the pinch method, I'll grab up my forceps. And we're going to use these to take the old dressing off. So I want to make sure that I'm kind of holding this while I take the dressing off, just to make sure that it's kind of stabilized. And then I'm going to take the dressing off, peeling towards the insertion site. I don't want to peel, down the arm, because then I have that chance of possibly ripping the catheter out. Okay, so this old dressing's off. I'm going to assess this for color, odor, consistency, and amount, and make sure that I am remembering that so I can document it. Okay, so the old dressing is off, And there is a stabilization device present here. The PICC line is sutured in. So I feel okay taking my hand off there because I know that that line will stay put based on those couple of sutures that they have put in there. So I can take my gloves off and I'm going to wash my hands. And then now we're going to start the sterile part of this procedure. So I'm going to go ahead, take my sterile gloves out. I'm going to put the sterile gloves on first. Okay. Sorry, these are sticking to the package. I don't know why. Okay, then we're going to put the other one on. Must have gotten something sticky on these last time I used. Okay, so my sterile gloves are on. And I want to make sure now that I'm keeping my hands above my waist at all times because my hands are sterile. So first things first, I'm going to grab my alcohol swab out of here. And then in kind of a circular motion, I'm going to work from inside and then outward, and I'll scrub, according to agency policy. I checked Chester's allergies before I started the procedure, and he doesn't have any allergies to cleaning solutions or anything, so we're good there. I didn't have to use anything special for him. Now I'm going to go ahead and use my ChloraPrep. I'll squeeze the edges to activate it. And then using some friction, I'll just kind of rub around there, get any dry blood or anything off of the skin. Make sure it's nice and clean. Okay, so that's all good. I'm going to drop that in there. Then I'll take my skin prep. I'm going to apply that in a window-like fashion just around where the dressing sticks. It's going to protect the skin and help that dressing stick. And now that everything's all clean and ready to go, I'm going to open up my dressing. Okay, and then I'm going to peel the back off. Using the no-touch technique, I'm going to put this right over the insertion site so that the insertion site is in the middle of this clear window. Okay. Now I can peel these edges off. These things are really sticky, sorry about that. Okay, so my dressing is off. I'm going to use this little label that comes with my dressing, put the date, the time, and my initials on there, and then I'm just going to use this as my extra piece of tape to help stabilize the catheter too. So we'll put that on there. And now at this point I can take my sterile gloves off. And then I'm going to wash my hands. And then I can take my patient's mask off. Wash my hands again. Take my own mask off. And wash my hands one more time. And then I'll kind of just make sure that all of my supplies are disposed of properly. I'll make sure that my client is in a comfortable and safe position before I leave him. So I'm going to make sure that his bed is all the way down. He has his call light, things of that nature. And Chester says he's all good to go, doesn't need my help with anything else. So we're good there. Then I'm just going to make sure that before I leave the room, I'm washing my hands, and then I have everything that I need to document. So I want to make sure that I'm documenting Rita, COCA, arm circumference, my IV site assessment, how the patient tolerated the procedure, that might be useful for future nurses, and yeah, date and time. So that's about it.